Mr. Simon Tan is going to share with us his cancer journey. He is also the secretary of the Singapore Cancer Society Prostate Cancer Support Group called the Walnut Warriors. You know why walnut? You know why, huh? Okay, so we will start with Mr. Tan first. Mr. Tan, could you give us a short introduction about yourself?
Okay, my name is Simon. I'm 63 years old. I got my cancer at the age of 47. I'm still working. I'm very healthy. When I got my cancer, I asked the doctor why I get cancer. The doctor said, cannot explain. So I just went for operation. And the worst part is that when I went to see Professor Fu, he said there's nothing wrong with me because my PSA is 6%. 6, not 6%, 6. The pointer is 6. So he gave me antibiotics. After antibiotics, it came out to 8. Then he said something wrong. So went for biopsy under Prof. Fu, Prof. Cheng, Christopher Cheng. Okay. After 1 week later, the Prof. Fu secretary called me on the phone. He said, Prof. Fu, I want to talk to you. On the phone, Prof. Fu said, Simon, you got cancer. I almost died. But anyway, I called my family. My family was feeling very down. My wife crying, my daughter crying, everybody's crying, except me. So I went and see Professor Fu, and I went and see Prof. Cheng. But Prof. Cheng was very, very good. He talked to me, he gave me the pros and cons, my whole family, and tell me, says that, Simon, you have cancer, these are the options you have. Since you're a very young age, you can have operation, you have radiation, you can have hormones. So he asked me one simple question. Are you going to have any more children? My children are all teenagers, so I said no. So he says, for your age, it's best to have operation. Okay, so I have an operation. I don't have any problem in incontinence. I don't have any problem ED. So everything was very good. I don't wake up in the night to pee. I sleep whole night up to now. I only wake up early in the morning, 6 o'clock, and go and pee. That's it. That's my, up to today. And I exercise regularly. I change my diet. I eat more vegetables, fish, lesser meat. I also have a hobby. So remember to have a hobby. This hobby will keep you off your mind, off your problem. I started with betta fish. Betta is a fighting fish, you know. It's a showcase fighting fish. Then after a while, I did costume jewelry. I teach costume jewelry at Cancer Society, and then I also do photography. And when Cancer Society called me, they said, Simon, we want to have a nationwide support group from Tan Tock Seng, from SGH, from NUH. So we started the support group called Walnut Warrior. Okay, so that's how we started it. We got about 6 or 7 of us, some are up there.
They're all cancer survivors?
So we are cancer survivors. And I survived 14 years up to today. Okay. How I found my cancer was very easy. I have a lower backache all the time. My urine wasn't very smooth. I went for a comprehensive medical checkup. And the doctor says, I'm so fit, sure I don't get cancer. So I went, second option, I went and see my company doctor and he referred me to Professor Fu. And that's how I got my cancer. And that's how the symptom came. Okay? And from the Walnut, in the Walnut Warrior at Cancer Society, we have men's plan, we have nutrition talk, we have all kinds of talks. And we also have excursion. And we also help those people who are starting to have cancer become patient ambassador. We became patient ambassador by explaining to those people who recently found that they got cancer, and we tell them what are the pros and cons and how to go about it, who are the doctors, what are your doctor, and then the nurses, how's your family like, your wife, especially the wives. My wife was my pillar. She supported me all the way, got no problem with her. And we encounter some wives who are very negative. Stay positive. Cancer is not a death sentence. Stay positive. So if you have all this problem or urinating tract problem, you got problem in your urine, please see your doctor. And if you have any problem, come and see us at Cancer Society. The Walnut Warrior is always there for you. Every second week of the month, we are always there at 2 o'clock, having a men's plan, having a talk, and having our social there. So come and join us. I even wrote a letter to ESM Go, asked him to join us. And that's how we do things. So a lot of people say, you're not afraid. I say, as a man, he also have, I also have. Whether you're straight or you're not straight, you still have. So you have this problem, so come. Don't worry, there's nothing to be shy about. Especially if you're a bit, as what Yasna says, if you're obese, you're fat, and you smoke a lot, please stop smoking, have a good lifestyle, exercise, Don't just sit and watch TV.
Okay, thank you very much, Simon. So we're very happy to hear that you're doing so well after your treatment. And I think Simon's story brings a few lessons for us. One, prostate cancer is not purely a disease only of elderly men. I mean, I think we normally say from the 50s onwards it can happen. In Simon's case, it happened a little bit earlier at 47. Two, early detection is key. I think because of early detection, he had good treatment, and therefore it's a good outcome. And of course, I think 3 is the role that the family plays in cancer survivorship. I think having a very supportive wife and family is key to a successful outcome.
We'd like to open the floor. Anyone has any question? If you have written a question, you can pass it to our volunteers. Just raise your hand. If you would like to ask the question yourself, yes. Would you like to come to the microphone? Thank you very much. We would like that you concise and precise your questions, and have one question only so the others have the opportunity.
Doctor, you mentioned about struggle in passing urine. What do you mean by struggle? Is it pain or is it delay? Something like that?
Thanks. This is the pre-symptoms you are asking.
Yes.
Pre-symptoms, pre-symptoms.
It can be varies, I mean, it's a lot to do with individual character and personality. A lot of the time, a lot of patients may have a bit of urinary symptoms, and these are very, very common. You're talking about after 2 cups of drink, you need to go and pass 15 minutes later, or you find that you take a while longer to empty your bladder compared to the guy next door who is 20 years younger than you. These are very, very subjective symptoms. Some men don't find it a problem, some men find it a problem, but if you are unsure, you think that you have a problem, you're taking longer for you to pass urine, you need to wait for some time, your urge has become intolerable, and you pass out 5 times a night to pass urine, you wake up 5 times a night to pass urine, for example. If you have any doubt, come to see us, you can assess whether there's a problem. And it can be due to just a fluid intake problem. I mean, if you are the type that drink a lot of coffee, a lot of alcohol, a lot of tea, okay, these are all diuretic, we call it. They make your urine, make your kidney produce a lot of urine, and as a result, you need to pass urine more often. It could be nothing wrong. So it's very subjective. Urination symptoms are very non-specific, and a lot of the time, they are not really helpful at all. So you need to come to see us, and we need to check on you, do physical examinations, and only then we can make some judgment to see whether really there's something wrong with you. Okay. Again, I say there could be other factors like family problems, how big the size of your prostate is. So symptoms alone sometimes may not be that useful.
Okay. So the quick question is this. Hypothetically speaking, I'm a man, and I go to the toilet. You're talking about frequency, etc., could be due to the diet, etc. But what if there's difficulty in passing, like you said, difficult to empty the bladder? Who should I approach first? Should I go to my GP? Is that the first point that we should go to the GP and let our GP know? What if my GP is a woman?
I think most general practitioners, those in the private or in the polyclinic, they are very well trained. I mean, these are very common urinary symptoms. Most of them have come through urology, and most of them can diagnose whether you have a problem. Again, age is very important. Okay, if you walk through the door and you are 75 years old, you have these symptoms, the likelihood you have prostate problem is higher than if you are 35 years old. Because your work stress, you drink 5 cups of coffee every night, and you find that you can't sleep well because of the stresses, or your children sleeping next door, kicking you up, keeping you up. So it's very subjective. It's very, very patient dependent. So yeah, do see a GP. Go to a polyclinic, for example. If there's a problem, we will see you, and we'll see what we can do.
I think importantly, like what Mr. Tan has said, Simon has said, is that he has a nagging pain at his lower back. He hasn't strained it. He's determined to find the cause. So he saw his doctor first, and then went for a thorough checkup. And even though his PSA was low, he wasn't wavered, which means he wants to find a root cause. You should be happy, or you should be healthy too. So you shouldn't feel discomfort or in pain. And if you do, you have to investigate. You have to investigate why. Good, bad posture, or there's something. These are signs and symptoms going in your body. It could be the hidden pussycat or the hidden tiger that's talking to you, wanting to tell you, please seek consultation. Any other questions from the ground? Yes? Okay, the PSA. Any doctor?
Okay. It's just a blood test. Okay, you can get it done anywhere. A GP can do it. As I say, if you have no symptoms, you're younger than 50 years old, no family history, perfectly healthy, younger man, we don't encourage you to just do it for the sake of doing it. Okay, if you're more than 50, there's a family history and you have symptoms, yes, it's very useful in that setting. It's quite a simple blood test. Okay, so if you have no symptoms, you are young, you don't even need to do it at all. Okay, if you have done it, it's abnormal, okay, then we need to follow it up. Okay, so we need to check you, we need to assess you, we do a physical examination, we do an ultrasound image of your prostate, and you may need a prostate biopsy. Okay, so once your PSA is abnormal, your prostate biopsy is done. If it's positive for cancer, then we will do what needs to be done. If it's negative for cancer, we need to follow you up. Usually about 6 months interval, 6 to 12 months interval. If your PSA is borderline or borderline abnormal or in the low range that you need to be follow up.
Just very importantly is, when you go for your executive health screening, some of you are still working, which means you are still a professional that the company provides you executive health screening. And the health screening may or may not include the PSA, and you can request. Sometimes you have to top up, sometimes it's in exchange for something else. That's one. The other one is when you go to your GP because of a certain symptoms, then you can request for one. So these are some of the options that you have. The doctor may or may not, because unless it's very specific. All right, we have another question from there, yes? The microphone will come to you, thank you. Yeah, it's good, we can hear you.
I took a PSA a few months ago, and my reading is 5.01. So then the doctor prescribed me a course of antibiotic, and then we do the blood test now is 4.32. So the doctor said that the reading is still there, so he need to do another blood test 4 months later. So why I raise this question is because I heard that this PIN biopsy, there is a risk there, and is uncomfortable. You say, if at this level, if it doesn't, the degree doesn't go down, or it remains there, should I take the option to do the biopsy?
Okay, so the PSA is a non-specific to cancer, specific to the prostate. So as Dr. Yuen has said, it can be due to inflammation or infection, and that's probably why your doctor prescribed some antibiotics, so that if it responds, then perhaps it's less likely to be cancer, because cancer will not respond to antibiotics. So your PSA has gone down. So PSA between 4 to 10, which is what you have, 4 point something, there's a 25% chance of cancer. Okay, it's not 100%, it's 25%. That means even if we biopsy you, we may not find cancer. So why he's asked you to do the PSA is to see the behavior of the PSA. So if the PSA continues to go down, then the suspicion that it's cancer is less. Or if it continues to go up 4, 5, 6, 7, 8, then you might start thinking, hey, this doesn't behave like infection, it's behaving more like cancer. And then he may then tell you that we should do the biopsy. So it depends on your individual circumstances. Of course, the doctor will assess you have a big prostate. Are there reasons why your PSA will be raised? Or if there are no reasons why your PSA should be raised, then they'll be thinking, is this, then the suspicion of cancer cells comes up again. As for the biopsy, there are risks, but most of them, to be honest, they're less than in like 2 to 3% range. Most patients do okay with the biopsy. And we do it under local anesthetic, so there may be some discomfort, but essentially most patients find it's okay. It's not like super painful or anything like that.
They have to warn you about the symptoms and the risk. Yes.
Right, 3% is still something. You cannot say it doesn't happen. It does happen. So we shouldn't underplay it, but we shouldn't overplay it either.
Yes. Any kind of operation, they will tell you there's a 2 to 3% of this or that. But you should continue to see your urologist and continue to do periodic blood tests and maintain a relationship with your urologist. Any other questions? Yes, we have one in front.
Yeah, it's related to incontinence. Previously, I got urine leak. So I went to see a specialist. So he prescribed this terazocine or yeah.
Terazosin.
Yeah, terazosin. But then after that, I got real incontinence. No? I got to urine in the middle of the night. No, every few hours though. But previously, I don't have that. No, I only leak only. Yeah, there was some urine leak there. So the thing is, does this drug actually cause this incontinence, or should I be stop taking this?
Okay, so before we go any further, I need to clarify what's the definition of incontinence in your case. Do you leak urine without knowing? You know, the urine just leaks out and then you realize, oh, I got a patch of wet over there. Is that what you're experiencing now? So what you're experiencing is more of what we call, in a big group, it's lower urinary tract symptoms. You have, do you have urgency when you need to go go to the toilet?
Before the teratocin, it's okay. You know, I mean, after urine, there's always just a little bit left. That is the reason that I went to see a specialist. But after that, he could prescribe the teratocin. Then now, in the middle of the night, I also have to go to urine. I wake up a few times. So again, is it related to prostate cancer? Or I don't know.
Okay, so if I may answer your question, right, I think you should see a urologist. The reason why I'm saying that is because, number one, the medication that you are given, the terazosin, is a medication we use very frequently to treat patients with prostate enlargement, or what we call BPH. All right, and what this medicine does is it helps to relax the prostate channel to allow a person to pass urine in a better way and reduce symptoms. In your case, if the medication did not work, then perhaps there may be something more to it than what was initially diagnosed, which is just BPH or prostate enlargement. Then the second thing is do not, I think in terms of timing-wise, you may think that, oh, he gave me the medication, I took the medication. After a while, now even at night, I need to pass urine. But do not forget that there's actually time. After he has given you the time, after giving you the medication, there's been a while, and then you start to develop all these symptoms. This could be an impression of a progression. Whatever you have may be progressing. The medication is not stopping it, but unlikely to be making it worse. So this is why I said that you should get a formal consultation with a urologist. That will be the best for you.
That's a... Why don't you seek second opinion? Okay, thank you very much. Simon, you want something to add?
I think the best is, as what doctor says, go and see your urologist, then go for a PSA test. Then from there, he will tell you whether, it's easier that way. Because if your specialist say no need. For me, my specialist will say no need, but because of my nagging in my head, I say, yeah, better go and see a second opinion. So when I see my family doctor says, Simon, you're so worried, send you to a urology. Professor Fu is my good friend, so just send me there, PSA test, that's it. And everything will be solved. So at least it gives you a clear mind, and it doesn't stress you up, you know. So why not second opinion is what she says, second opinion. Just go for a PSA test. I think there's no harm doing a PSA test.
So go for your second opinion, sir. Just a moment. Next question.
Hello. We can hear you. Can you hear? I myself is a prostate cancer patient going for therapy. Initially, my choice between therapy and surgery was surgery. But because of my heart condition, my doctor advised me, you go for therapy. It may be dangerous to go for surgery. So my question is, assuming that if I have no heart condition, is it still better to have a surgery? Because in my mind, surgery is better because surgery is once and for all. You remove the prostate, so then nothing will happen in the future. But if I leave it there and I go under treatment, in future it may come back again. All right. So my PSA is 6 to 7. So the doctor said you are in the stage 3. So I'm 65 years old. Okay, the last question I just want to ask is that I saw some of the notes that Dr. Lincoln Tan has it. I was trying to scribble it down, but unfortunately I can't go that fast. Is there any way of getting a copy of your notes for my reference? Or anywhere I can buy it, or any book that I can buy.
Okay, let me answer the first question first. Okay, in terms of cancer survival, as I said in my talk, surgery and radiation are considered as equivalent. Okay, so when we decide between surgery or radiation, I never tell my patients, oh, one will cure you better than the other. They're about the same, but both have their pros and cons. So it really depends on, we have to individualize to the patient. So if you have a heart condition that makes surgery dangerous, then that option is not available for you. So you don't need to think about that anymore because when I say cancer, we're talking about 5, 10, 15 years kind of thing. If you get a heart attack while doing surgery, you could die on the table. Yeah. You know, or it can significantly reduce your lifespan compared to the cancer. So the heart become the main problem and not the cancer anymore. So if your specialist has reservations about putting you through surgery, they must have a good reason for it. And perhaps then don't think about that option anymore if it's that dangerous. So I think if he recommends radiation and surgery, like I said, in terms of cancer, survival rates are equivalent. Okay, so you're not getting an inferior treatment. It's just a different things you have to go through.
But the trouble is that the doctor who did the heart surgery for me, he recommended the surgery on the same basis that surgery will remove the problem once and for all. So, I mean, you know, so is he taking the risk or whatever it is, or there are other reasons?
Okay, maybe I just want to add. I think it's very, very common in this forum when, for the public. Once you hear cancer, straight away there's a phobia, there's a fear. And this is really understandable. I mean, if I'm not in the medical profession, I'm not a urologist, and I heard about cancer, I want it to be out. Straight away, I want it to be out. But I think you have to understand, treatment for cancer is more than surgery a lot of the time. For example, you have lymphoma, for example. Cancer of the blood, there's no way you can cut it out. Okay, it's chemotherapy, that will cure you. If you have cancer of the, what we call the throat, the nasopharyngeal, and it's not surgery, you know, it's actually radiotherapy. You cannot cut your throat out, okay? And you'll be cured. So treatment for cancer is more than surgery. Surgery plays an important part, okay, for a lot of the cancer, but it's not the only treatment. Dr. Tan has mentioned correctly, radiotherapy to the prostate is not an inferior treatment. It's a curative treatment for cancer. And in fact, there are more and more data that come out that show that probably radiotherapy has a better chance of curing your cancer than surgery for prostate. And again, there are also individual patients' variations. Okay, depending on the type of cancer you're having. And strange enough, if you have stage 3 prostate cancer, like what you mentioned now, you probably will be better having radiation than surgery, because there's a chance that if you have stage 3 prostate cancer, that surgery cannot adequately remove all your cancer, while radiation will be able to cover it. So if your heart doctor advises you, give you advice for treatment of prostate cancer, probably you should listen to the urologist rather than your heart doctor. Okay? So don't let the fear of cancer, okay, cloud your judgment and your decisions. Okay? So, I mean, it's quite clear now, radiations give you equal cure for prostate cancer. It's what you want after that, okay? These complications with radiations and the complication with surgery, which one would you inclined to have? But having said that, I mean, I myself do what we call brachytherapy for prostate cancer. We do not see incontinence, for example. It's almost unheard of for people with radiation to the prostate for prostate cancer. And the side effect profile is very favorable. It's something that is catching up. And what I can tell you is, once you have a diagnosis of prostate cancer, don't be too fearful. This is not the end of the road. And if radiations is what you have chosen, if radiation is what is being advised, and this is the right treatment, and it's as good, if not better, than surgery for some patients. And you should go and find out more.
Thank you. Thank you, Dr. Yuan. May I have the microphone back, please, sir? Thank you. We have some more questions from the floor. We have to be fair to the doctors and also the rest of the people. Thank you. We do have a couple of questions more, but we would like to respect the doctor's time. So if you could stay put, we're going to take you another 10 minutes. Could you stay with us for another 10 minutes? Thank you very much. Okay, the doctors has taken the time to come with us. Let's show some respect into the guests that we have on stage. Now, we're going to have one more question, and I'm going to consolidate the questions due to time. So could you tell me your questions and see how I could consolidate this question? Just a moment, please. Okay, we have a question here, and this is discomfort, slight pain towards the end of the urine. And the pain is in the groin area and at the penis after taking spicy food and alcohol. So normally it will be pain at the end, and after spicy food and alcohol, there will be also pain at the area of the penis and the groin area. Now, so is this symptoms of prostate cancer or bladder cancer? And the urine flow is slow, but there's quantity, especially in the night, and it needs help. So do you recommend a removal of the prostate? This is a very extreme question, but there are people who actually have that thought. So we thought we should pull this question and fold.
Okay, so all these symptoms are very non-specific. In itself, we cannot tell from symptoms whether you have bladder cancer or prostate cancer. All it means that there's something going on. You need to see a doctor or a specialist. And after that evaluation, you will get a better idea. So no matter whatever combination of symptoms you may have here, the end answer is that you need to see a doctor. And that's the key. Don't ignore. It's good that you brought it up. Don't hide it. Don't keep it to yourself. Bring it up, see a doctor, and get it evaluated.
Yes, very importantly, you should not feel discomfort. Now, the doctors will be outside later. They could take some private questions too. And as to the question about the slides, they will be uploaded to YouTube after Monday. Okay, so search. Ladies and gentlemen, please join me. Give a big hand to Mr. Simon Tan, Dr. Lee, Dr. Yuan, and Dr. Tan. And we would like to invite the COO of the Singapore Cancer Society to present a token of appreciation to our three speakers. Thank you very much. Please give them a big hand. It's a Saturday. They came for us. They answer your questions. You now know what happened to that walnut. So look after your walnut. And if you are a cancer survivor, kudos to you. Please give a big hand to our survivors. If you have any questions, please see your GP first and persist. You can always have a second opinion. So thank you very much, gentlemen. Please rise. Thank you. And please give our doctors another big hand, thanking them for this afternoon. Okay, your health is in your hands. So look after yourself, stay healthy, have a great weekend. Thank you very much. My name is Ivy Lim. Have a good weekend. Thank you very much, ladies and gentlemen. Thank you. Thank you.